Some people are set up to be addicts and unfortunately never get out of it. Some people are set up to be addicts and they do get out of it. It's not better or worse. It's just a matter of like actually viewing it as a disease that people are born with rather than something that they choose to make these decisions that are destructive decisions. Like nobody would ever choose to do the things that I did without being afflicted by a disorder.
Look around the room. How many people do you see? Do you see 10, 20, maybe 30? At least 3 of you will struggle with substance addiction. Look to the person to your right. Do you know them? Are they just a classmate? Or are they a friend? Maybe even a best friend. They could be one of the 3 to become addicted to drugs. Do they fit with the picture you have in your head of a drug addict? When you walk downtown and see someone yelling at the air, do you cross the street? Do you look away? Do you laugh? It's not a nameless character that you judge as you walk by. It's a person. They were once a child. They have a mother, a father. They themselves might have children. You don't know. You don't know their story. So what is it that separates them from you? It could be something as accepted as alcohol or as taboo as cocaine. And it could happen to anyone. Addiction is a disease. There is no choice in how addicted to a substance one can become. Different drugs have the ability to affect the body in numerous ways, and each individual response to the drug is going to vary from someone else's experience. Combine addiction with incarceration, and the result is disastrous. There is no help for those struggling with addiction, no stabilizing treatment plan during incarceration or after. How can we expect people to get better if our entire government has organized a system simply for them to fail? Our justice system is broken. It condemns the very people it is supposed to help, and it makes it almost impossible to recover from a drug addiction. Over 10% of the United States population struggles with addiction. So why is it that our justice system does not recognize treatment as the only option, but as an essential key to the recovery of both individuals and our society as a whole? Drug addiction is not a choice. It is a mental and or physical disease that needs to be dealt with as such. Our government and our community needs to help overcome those struggling with addiction. It shouldn't be called the war on drugs. It's a fight for recovery. This is a fight for all of us, not just those with the disease. 10% of the population struggles with addiction. 3 in a class of 30 will have to battle with a substance addiction. How do you know that you're not one of the 3?
1986. Federal lawmakers enact a minimum sentence guideline. These fixed sentences are based on weight of drug, type of drug, and past convictions. The punishment for possession of drugs in the U.S. is incredibly wide. For example, Kentucky. For a simple possession, first-time offenders in Kentucky can get 2 to 10 years in prison and fines up to $20,000. In contrast, California has some of the lightest drug possession sentences, between $30 and $500 in fines and or 15 to 180 days in jail. With recent legalization of marijuana, tickets for possession of marijuana while being under the influence of said drug is not unlike a parking ticket. As an alternative, states should have an option for second or third-time offenders that, instead of being sentenced to jail, they are sent to a program for felon drug defendants and will spend roughly 12 to 15 months working towards rehabilitation and participating in random drug tests and drug treatment appointments. This will keep them from relapsing and may also help them be positive contributors to our society. About 74% of inmates with mental illness have been dependent or addicted to drugs or alcohol prior to incarceration in the state. Over one-third of the state prisoners with mental health illnesses have admitted to being influenced by drugs during the offense. Over 50% of the inmates in federal prisons are there due to drug-related offenses and have been rising since 1970 by 16%. Since America declared a war on drugs, the percent of drug users has continued to increase along with the concentration of hard drugs, while the price decreases. Global consumption of opiates has increased by 35%, cocaine by 27%, and marijuana by 9%, respectively, between 1998 and 2008. For the incarceration of mental health illness, jail time without proper medical treatment is a violation of the Eighth Amendment against cruel and unusual punishment.
Drugabuse.org classifies drug addiction as a mental illness. This is because, quote, addiction changes the brain in fundamental ways, disturbing a person's normal hierarchy of needs and desires and substituting new priorities connected with procuring and using the drug. The resulting compulsive behaviors that override the ability to control impulses, despite the consequences, are similar to hallmarks of other mental illnesses. In simpler terms, this means that when under the influences of both drugs and addiction, nothing matters as much as getting more. When a mentally ill person commits a crime, they are given the chance to plead not guilty by reason of insanity, or guilty but insane or mentally ill. This means the defendant is committed to a psychiatric facility for help, rather than jail. When it comes to drugs, this is not the case. Criminalizing drugs in the way that we do means that even when someone's brain chemistry has changed to make getting more drugs their number one priority, they are still punished as a criminal, not as someone who is sick. I decided to interview a friend and mentor of mine, Andy, who has struggled with drug abuse until a few years ago.
I was put on prescription medications when I was like 16 for pain. So I guess the abuse part came more when I began abusing them, and I was on them for 14 years. Mm-hmm. So on prescription medication as well. I mean, I considered alcohol a drug as well, and that I started drinking when I was probably 14. That was always my favorite thing to do. I stopped taking my prescriptions. I stopped doing my drugs, basically, in January of 2013, and I just stopped.
Andy was prescribed Suboxone, or buprenorphine, a drug that is given to help addiction and to treat withdrawal. Suboxone is classified as an opioid, and just like her previous prescription meds, has a high risk for addiction and dependence. Andy refused this and decided to deal with the withdrawal without the help of any other substances. She experienced hallucinations, shaking, vomiting, and other symptoms for 13 days and wasn't able to sleep long or well for a year. Surviving withdrawal like this without the help of other substances is incredibly hard and somewhat uncommon, and doctors have since asked her how she made it.
I just got to a certain point where I was done being a drunk. I got to a certain point where I was done. I got clean from alcohol 1 year and 1 day after I got clean off of drugs. So I just got to a certain point, like when I got off of drugs, I didn't really have anything else, and alcohol is a legal drug. And when I started feeling better, all of my friends were like, let me buy you a drink, like come out with me, blah, blah, blah. And I was like, okay. And I've been an alcoholic my entire life. I was born an alcoholic. I'll die an alcoholic, whether if I ever drink again or not. But that was something that I really latched onto after drugs, and so I had to like kick that eventually as well. And for me, it just like gets to a certain point where you're just over what you're doing. And if you're not gonna like die or just be able to be consistently drunk, then you have to like do other shit. I just got bored, basically. I think that if people are treated as patients instead of criminals, there will be, you will immediately see just that amount of respect given to like, yo, you're struggling. Like I can see that this is like hard for you. Like you don't want to be fucking doing this, right? And they don't want to, most people don't want to be doing this. And so if you offer just that human respect and like, I see that you're struggling, this is a way, and like, I see that this is not something that you choose. Whereas if you scold somebody and you make them feel like shit about it, you make them fucking go to jail for stealing a TV to get a drug that if it wasn't illegal, the TV would still be there. Like, it's not, you know, just decriminalization and treating them as if they had diabetes and they were stealing things to get insulin shots, you know, where would we be? Would, you know, diabetes would be like, oh, he's a diabetic. Like, it would be like that, you know? Mm-hmm. And that's just a disorder that someone's born with, as is alcoholism and drug addiction. So that's basically how I feel about that.
Human Rights Watch reports that more than 25,000 people in the United States have been convicted of a crime committed before they were 18 years old and sentenced to life without parole. According to the National Drug Intelligence Center, the most commonly used drugs by teenagers are marijuana, heroin, cocaine, Vicodin, crystal meth, Oxycontin, and ecstasy. Adults who are caught with controlled substances are charged with a crime and have their cases handled in a regular trial court. Juveniles, however, may be handled more informally. Some penalties are probation, community service, Narcotics Anonymous, behavioral management programs, therapy sessions, and residential drug rehabilitation programs. However, not every teen will be considered for alternative sentencing. When a judge determines if a teen meets the requirements, the judge takes into consideration a juvenile's criminal history, his or her character, the nature and circumstances of the crime, the risks and needs of a juvenile, and the necessity to imprison a teen for the public protection. Studies show that youth of color are treated more harshly than white youth, even when arrested and prosecuted for the same offense. For example, white youth are more than a third more likely to have sold drugs than African American youth. Yet, African American youth are arrested at twice the rate of whites and represent 48% of all the youth incarcerated for a drug offense. The fact that that is almost half is mind-blowing. These are not guaranteed or fair solutions. We must be progressive.
She told a friend she had wanted to use one more time. So she got some heroin and smoked it. And the neurologist explained to me that even when you smoke heroin, when it crosses the brain, it can cause a reaction that causes a cardiac arrest. And that's what happened with Morgan.
Criminal justice reform advocates want to roll back mandatory minimum sentencing for drug networks. They say that punishments are used too often on low-level, nonviolent drug dealers, but there is no punishment enough to come near the devastation to families victims to overdose.
I don't agree with them reducing the sentences for drug dealers or couriers, especially for heroin. Morgan's a beautiful girl, and she's so talented. She was on the honor roll all through middle school, and she was on the track and field team. She loved dancing, loves people, and she's still beautiful. But she can't walk. She can't feed herself. She's depressed. She is very grateful. She's told me before, "I'm so glad you didn't give up on me."
Do you want a headband on, Morgan?
Yeah.
Morgan is my cousin and best friend. I kind of just wanted to be just like her. Anything Morgan wore, anything Morgan did, I was right behind her. No, it's okay. I think it scared our little siblings, and it's definitely made a big impact on me and my brother and the older kids of the clan.
Drug abuse and overdose affects everyone around us and our society as a whole. The youth is being influenced by addiction and is surrounded by destruction. The youth is the future. We must stop this violent cycle.
I've seen young people who are so affected by maybe a parent or someone they care about go through addiction and struggle with it and want to be with their parent and eventually giving up and saying, "I guess I'll use too." It's absolutely deadly, and it destroys families.
After incarceration and addiction, it is crucial to get people the help and treatment they need. Many aren't given that chance and find treatment through self-help programs. This can be helpful, although the majority of the time it is more damaging. The issues with self-help programs, especially online chat rooms, is that they often lead to people one-upping each other and relapsing. The most helpful treatment centers are the ones that show the community that people not only want to better themselves, but also the environment around them.
As part of our commitment to aiding clients who are diagnosed with a mental illness, we offer psychosocial rehab, which is basically a group therapy session with between 12 and 15 other individuals with like illnesses, and we go over daily living skills, keeping up with medical appointments. We also do anger management training, things how to communicate with others, making sure you're eating nutritious foods.
The system is flawed because it doesn't allow people to mess up or be human. Once incarcerated, being let out only leads to more issues. Every minimum wage job application asks if people have a felony, let alone the in-depth questions when applying for a job that will get people the income they need to support themselves. Often people leave with less than $100 cash and no family support. This leads to people not being able to get a job, therefore going back to the same selling, using, jail cycle. Since the system isn't doing enough to help people find jobs or houses before their sentence is up, or enforcing and funding mandated treatment so that they have the ability and resources they need to overcome their addiction. Addiction of any type is a mental illness, ranging from drug addiction to anorexia, and should be treated equally in treatment.